Hey everyone! Today I'm diving into a common but often misunderstood condition, whitlow. If you've ever had painful, swollen fingers with tiny blisters, you might have experienced this firsthand. So, what exactly is whitlow? Whitlow, also called herpetic whitlow, is an infection caused by the herpes simplex virus, or HSV. It usually affects the fingers, making everyday tasks like typing or holding objects pretty difficult. Now, how does this virus get into your fingers? The virus enters through tiny cuts, scratches or breaks in the skin. You might not even notice the injury, but it's an easy way in for the herpes virus. Where does this virus come from? Well, it usually comes from cold sores, HSV1, or genital herpes, HSV2. If someone with a cold sore touches their lips and then their finger, they can transfer the virus. The same goes for genital herpes. Touch an infected area, then touch your finger, and boom, infection. Who's at risk? Healthcare workers, especially dentists or nurses, parents of young children, and anyone with cold sores or genital herpes are more likely to get whitlow. Symptoms usually show up 20 days after the virus gets into the skin. You'll notice intense pain, swelling, redness, small fluid-filled blisters, and maybe a burning or tingling feeling before the blisters appear. Is it life-threatening? While whitlow isn't life-threatening, it can be very painful and might interfere with your daily activities. Without treatment, the infection could spread to other parts of your body or to other people. So how is it treated? Antiviral medications can reduce symptoms and speed up recovery. Over-the-counter painkillers can help manage the discomfort. And remember, avoid popping those blisters. It can worsen the infection and spread the virus. Rest that finger, keep it clean and dry, and avoid unnecessary movement. But did you know whitlow can also be caused by bacteria? Unlike herpetic whitlow, bacterial whitlow happens when bacteria enter small cuts or injuries on the fingers. It's often caused by Staphylococcus aureus or Streptococcus pyogenes. How does bacterial whitlow happen? Bacteria enter through tiny cuts, splinters, or even hangnails. Nail biting or poor nail hygiene can also be culprits. Once inside, the bacteria multiply and cause an infection. Who's at risk? People with poor hand hygiene, nail biters, those who pick at their cuticles, and healthcare workers exposed to patients with infections. Symptom: redness, swelling, severe pain, warmth, throbbing and pus-filled blisters or abscesses near the nail. Is it life-threatening? If treated early, usually not, but if left untreated, the infection can spread deeper into the finger, causing bone or joint infections, form large abscesses, or spread to other parts of the body. How is it treated? Soak the finger in warm, soapy water 3-4 times a day to reduce swelling and help drain pus. Severe cases might need antibiotics, and an abscess might need to be drained by a healthcare provider. Can you prevent bacterial whitlow? Absolutely. Keep your hands clean, avoid biting your nails, treat small cuts promptly, and wear gloves when working with sharp or dirty objects. While bacterial whitlow isn't directly contagious like herpetic whitlow, the bacteria can spread if proper hygiene isn't maintained. So have you or someone you know dealt with any of these forms of whitlow? Share your experience below or let me know if you have any questions. Thanks for watching and stay healthy.